Your stool may be giving you health warnings before your body says anything else. Black, red, pale, greasy, foul smelling stool. This can sometimes signal real disease. Most people flush and forget, but your stool color smell can reveal bleeding, liver problems, infection, malabsorption. And I wanted to talk about this because I had a patient where a patient is having a clay colored stool. And so when I see my patients and start exploring certain things, and then I like to create video for my followers. Um, in this video, I'll explain in simple language how stool color, smell may reflect different disease process, um, what is often harmless, and which warning signs should never be ignored. So normal stool color. Normally stool is brown. That brown color mostly comes from bile. A digestive fluid may be made by the liver. As bile moves through the intestine, it changes from greenish yellow to brown. That is why different shades of brown are considered normal. Even greenish stool sometimes still be normal. So greenish stool often happens because food moves through the gut too quickly, especially during diarrhea, so bile does not have enough time to fully break it down. It can also happen after eating lots of leafy greens or foods with green dye, or some medicines or iron supplements may also change stool color. Persistent green stool with diarrhea or dehydration sometimes should be evaluated. So sometimes a green stool means spinach, but sometimes it means your intestines are rushing things through too fast. Black stool. Black stool can be harmless if you took iron supplements or bismuth medicine like Pepto-Bismol. But black tar-like stool can also mean bleeding from upper digestive tract, such as a stomach or a small intestine. This is important because upper GI bleeding can come from ulcer, gastritis, or serious condition. If black stool is new, sticky, tarry, or happens with weakness, dizziness, abdominal pain, you need to get medical help quickly. Red stool. Red stool may simply come from blood or food like beets or red food coloring, but it can also mean rectal or lower GI bleeding. Medical sources know that rectal bleeding can happen with hemorrhoids, fissures, inflammatory bowel disease, diverticular disease, or colorectal cancer, or polyps. Bright red stool is not always cancer, but it should never be ignored if you do not know the reason. Number 5, pale white clay colored stool. This is one of the most concerning stool colors. White or clay colored stool can happen when not enough bile reaches the intestine. That may point to a bile duct blockage, gallbladder problem, or liver disease. And the Mayo Clinic advises that white stool is not typical and should be medically evaluated. If stool loses its brown color completely, your bile flow may be the real problem. Number 6, yellow, greasy, frothy, hard to flush stool. Yellow stool, especially if it looks greasy or floats, can suggest fat malabsorption, also called steatorrhea, and is found in celiac disease or malabsorption. It can be foul smelling, greasy, frothy. Conditions affecting pancreas, bile flow, or a small intestine may also lead to fatty stool. And it's commonly seen in celiac disease, chronic pancreatitis, or pancreatic insufficiency, bile duct problem, or some other intestinal disorder. What about stool smell? Stool always has an odor, but unusually foul, rotten, greasy, or sour smell can suggest abdominal digestion, abnormal digestion problem, infection, malabsorption. Foul smelling greasy stool is especially important when the body is not absorbing fat properly, as seen in steatorrhea. Infections and food poisoning may also change stool color, especially when diarrhea is present. A smell alone usually does not diagnose the disease, but a smell plus color change, or diarrhea, or weight loss, pain, fever, or blood becomes much more meaningful. Shape and consistency matter too. It is not only color and smell, shape matters as well. There is a Bristol stool chart is commonly used to describe a stool from hard lumps to watery diarrhea. And this helps doctor understand constipation, diarrhea, and transit time. When to see a doctor? If you have black tarry stool, red or bloody stool, white or clay colored stool, persistent yellow greasy stool changes lasting more than few days without a clear reason, weight loss, fever, abdominal pain, dizziness, weakness, along with the stool changes. So yes, stool color and smell can sometimes give real clues about disease process happening inside your body. Brown is usually normal, green is often harmless, but black, red, pale, greasy, foul smelling stool may point to bleeding, bile flow problems, infection, and malabsorption shouldn't be ignored. I'm Dr. PK from Dr. PK Live. Thank you for watching.